Hi, Wiley Long with HSA for America, and today I'd like to talk to you about the so-called public option. So today the Senate Finance Committee is discussing the Senate bill, and one of the things that they are reconsidering is whether or not there should be a public option. And a public option at first glance sounds great. Why would anybody be against something that increases competition, that causes competing businesses to try to lower their prices, increase the quality of their services, increase the convenience so they can get more market share? And if they can't win in the marketplace, then shouldn't the business go to the company, or in this case government, that provides the best service at the lowest cost? Sounds pretty good, but we have to ask ourselves, why do we need a public option for health insurance? We don't have a public option for fast food restaurants. We don't have a public option for laptop computer makers. Can you imagine if we did? I got a feeling nobody would be eating at McGovernment's hamburger joint. Just a guess. But let's talk about this. Why do we need this public option, or do we need this public option? Well, I ran quotes for myself and my family here in the state of Colorado, and I came up with 642 different private health insurance plans to choose from. 642. So would 643 make a difference? Would having that public option really help? Well, it's hard to make that argument. The insurance companies in this state are competing very hard to attract business, and they are doing all they can to offer the best rates and the best coverage, so they do attract more customers. But that's not the case in all states. There are some states where there are only a couple insurance companies offering a handful of plans. So maybe we need a public option in those states, or maybe we need to ask ourselves exactly why are more insurance companies not competing for the business in those states. And if we do that, we start to see some answers. We see that the states where there's not a lot of companies competing for the business are states that put some onerous regulations and requirements on insurance companies that make it very difficult for them to not lose money by going into business in that state. And so that's why they choose not to. So what are some of these regulations? Well, there's guaranteed issue laws. And guaranteed issue laws create an incentive where somebody may decide not to carry health insurance until they get sick, because they know at that point they can buy a plan. Well, when that happens in the marketplace, not enough healthy people buy health insurance. Only the sick people buy health insurance, and the rates get very, very expensive. And of course, an insurance company that's doing business in that state has got to face the prospects that they will just be insuring people that have a lot of health problems. Another thing that a lot of these states do is they put limits on how much can be charged based on age. So what tends to happen in those states is, because of the lobbying power of older generations compared to people in their 20s, we get a situation where rates are capped for older people, and thus the younger people are subsidizing the premiums of the older folks. And as a matter of fact, these are two of the provisions that are part of the current health care proposals that are being considered. So we can see why companies don't compete for the business in all states like they do here in Colorado, and the problems that causes. And generally that's a direct result of government overregulation. But so what? Why not have a public option anyway? Well, the liberal side of the Democrats in Congress are pushing very, very hard for a public option. Now, we can ask ourselves, is this because they believe so strongly in the free market and the benefits of competition, or is there another reason why they want a public option so badly? Well, if we ask that question, we can quickly see that something else is going on slightly undercover here. And what is going on is the reason they want a public option is because what they really want is a government takeover, single-payer healthcare system. That is the whole purpose behind this push for a public option, or a so-called public option. So, just keep that in mind when you're considering what these proposals are and what Congress is really wanting to do about the current healthcare situation in this country.